Good evening, and welcome back to Rural Health Matters. I'm Dr. Jeff Gold, and we're so pleased to have you back with us tonight. As we move through the seasonal transition from winter to spring, farmers and ranchers face a new set of safety challenges, from unpredictable weather patterns and calving seasons to concerns about the H5N1 outbreak. Farm safety is a year-round priority, and tonight we're going to discuss the unique risks that come with the changing seasons and the conditions that we just talked about, and how we can better prepare for them. But first, let's take a look at the latest health data and what it means for our rural communities. And as we always do on Rural Health Matters, let's start off with getting some of the COVID updates. And of course, the news tonight is really good news across the country. These are some of the Centers for Disease Control and Prevention metrics that look at early indicators such as test positivity, emergency department visits, but also look at severity indicators such as hospitalizations and COVID-related deaths. Small changes in all of these categories, but all favorable. 4.6% of the tests that are done, and these, of course, are the PCR tests, not the home tests, are positive. Emergency department visits have gone down from 1% to just under 1% at 0.9%. Severity indicators show that we're down to approximately 2.9 hospitalizations per 100,000 hospitalizations. And even the death rate, which has been so slow to change, has now gone down from 1.2 to 1.1% of all the deaths in the U.S. The trends of the virus type continue to change, and it's important to see here that the XEC strain is still the largest, shown here in the green bars on this most recent nowcast projection. However, the LP version of the virus, also an Omicron subtype variant, continues to grow in the prevalence and is now up to almost a third of all the infections that are getting typed in the United States. Now, we don't really know what the numbers are because the overwhelming majority of infections are not being serotyped, and so we don't really know what the genetic strain is. But the consistency of what we do have access to through hospital visits, clinic visits, emergency room visits, etc., shows that the number of LP variants which are more transmissible, outcompeting the XEC Omicron variants, are rapidly becoming the dominant variant in the United States. The good news is these do not appear to be more severe. The good news is they do not appear to evade our vaccines any more than the earlier variants. The bad news is that they're just even more competitive than the XEC subtypes, with more binding capability to our respiratory endothelial cells. This is a look at the CDC case fatality rates of weekly deaths. And when we look back just over the last year, you can see by the location of this red dotted line, we are well under the number of deaths per week. A year ago, we had 1,400 approximately deaths per week. Last week, we had about 800 deaths per week. Again, that is still an awful lot of people dying, but the number of cases and the number of deaths from influenza, mostly flu A, have now exceeded the deaths from COVID. And I don't know if that's the good news or the bad news, because both of them are pretty severe, both of them are causing hospitalizations, and both of them are taking lives, particularly of older and people with multiple medical conditions, immunocompromised, etc. If we look over the last year at some of the COVID wastewater numbers, you can see they appear to be pretty flat. And when we focus in on the last 45 days, you can see that in almost every part of the country, going back to the very first week of February and even back to the middle of January, the numbers had come down slightly, but they really haven't changed. And we are, depending upon whether we're in the Midwest, which is ranked high, or whether we're in the Northeast, which is ranked right at the border of moderate and low, we're still at least in the moderate range for most of the country in terms of the amount of wastewater viral particles of COVID that are being detected. Again, concerning, as it would be nice, particularly this time of year, to see these numbers continue to fall off. So a little update on influenza. I'd like to start off with avian flu, or also known as high pathogenic avian flu. We're up to 162,801,000 poultry affected as of February 21st, as of the end of last week. 973 dairy herds affected, mostly in California, and all in the same 16 states that we've been reporting now for quite some time. You know, when we look at the milking dairy cattle, what you can see here, which is rather significantly changed, is while it was almost exclusively California, the most recent announcements of detection is in Arizona. You see Nevada has made this list. And so in this part of the southwestern United States, we are starting to see other states with more dairy cattle being affected. And that has changed also in terms of the number of human cases. The number of human cases is now up to 70. Now, granted, these numbers are small. The severity of the infection generally is low, although there have been several additional hospitalizations, and we'll talk a bit about that more in a second. Of the 70 human cases, 41, or about 60% of them, 65%, are associated with dairy herds, and 24 are associated with poultry farms and poultry culling operations. So this is still very much a dairy and a poultry spread infection to human beings. There is really no confirmed human-to-human spread of this, in spite of the amount that we're seeing in dairy cattle and in poultry. So as I said, Wyoming Department of Health has now confirmed the state's first human case. This case is the third confirmed hospitalization related to the virus in the United States. And also over the same weekend, last weekend, Ohio Department of Health confirmed to CBS News that a farmer in the state of Ohio was sickened with bird flu and was also hospitalized. He's since been released, making it the fourth hospitalization in the United States. So, you know, one tree does not a forest make by any means, but the fact that we're seeing cases, human cases, now confirmed, again, associated with dairy cattle and associated with poultry operations, but associated with sufficient severity to result in hospitalization, is of some concern, and we'll continue to follow these developing stories and report them for you right here on Rural Health Matters. This was a study that I gave you a snapshot of last week, and I wanted to provide some follow-up for you. This was a public health study that was done that looked at individuals, bovine veterinary practitioners. So these are the vets and the vet techs that handle our veterinary medicine on our large poultry production facilities and on our dairy cattle, of course, and all of our bovine and porcine facilities. And what this reported out was that 3 practitioners had evidence of recent infection of the virus, and 2 without exposure to animals with known suspected high-path flu, and 1 who did not practice in a U.S. state with any documented high-path flu were confirmed to be infected. Now, these were all mild cases. These individuals really did not know, other than the first 3, that they actually had any type of influenza. And so this just makes the point that there is ongoing spread both in dairy cattle and in poultry that is not being documented, and there's ongoing spread to the veterinarians and the veterinary practice, and of course to the farm workers that are caring for these animal production facilities. Something that we knew, but having data is significant. This is another report that says within the past 10 days, 3 different states in the U.S. have reported new, known, and likely bird flu infections in humans. We've talked a little bit about Ohio. We add Wyoming to that, and now, of course, an individual in Colorado was recently added to the list. Again, very small numbers, not terribly severe illness, but worth bringing out. And we'll talk a little bit about some of the research when we introduce Dr. Ellen Duysen in just a few minutes. This was a report that I also alluded to last week, and I just wanted to share with you that this new company has been announced by the United States Department of Agriculture Center for Veterinary Biologics, better known as the CVB, has issued a conditional license for avian influenza vaccine, H5N2 subtype killed virus, so this is incapacitated virus, for use in chickens. And the idea here, of course, is to be able to stop the spread of bird flu, which is highly lethal in the poultry production facilities. Now, this is obviously not going to have any impact on wild birds, which are the major source of spread, we believe, in most of these infectious sites. However, within our poultry herds, there's now a vaccine that should become available. And they say that, this is a quote, that the decision to vaccinate commercial poultry flocks against high-path avian flu rests solely with the national regulatory authorities in partnership with the poultry industry. And so I would advise those of you that are producers of poultry, egg layers and others, if you're interested in this, go to the Center for Veterinary Biologics website. It's part of the USDA website, and they'll give you information on how you could access some of this material if you're interested in being part of it. Now, on a much bigger picture across the United States is the story about flu A in humans, and you can see a map here as to the density, but all of the trends regarding outpatient respiratory illness, continued increase in the number of jurisdictions with high cases, all the diagnostic testing, the flu mortality rates both in adults and children just continue to rise. And there are any number of cases of colleagues and friends of mine who, get diagnosed with the flu. The good news is there are very good, highly effective, and very low complication rate oral agents such as Tamiflu and others that can be prescribed that really will nip influenza clinically right in the bud. And so if you think that you may have the flu, fever, chills, muscle aches, early on, it's certainly most effective in the first 2 to 4 days of the infection. Get tested. Home test kits are available. And if you test positive for flu A or flu B for that matter, give your local practitioner a call and get started on a 5-day regimen of one of these medications. It can be life-saving, particularly in older individuals. And so a couple worldwide updates that I wanted to share with you, some good news, some concerning news, but just to give you an update, here's some good news. Uganda has declared that the Ebola virus outbreak that had occurred in Uganda with 8 patients are now over. So there's been no spread. Now they have to get to at least 21 days and hopefully 45 days without any new diagnosed cases to formally declare it over, but they are now declaring it contained. And that is really good news. The individuals who were treated from all discharged from the hospital in the capital city known as Kampala, and that means that if this is contained and hopefully ended, the chance of spread to other surrounding countries and to other parts of the world through air travel has been eliminated. So good news there. Ebola is not a friendly disease. However, within our country, as I've been reporting, Measles cases continue to rise. There are now 58 new cases as of last Tuesday and in Texas, and 8 people in neighboring eastern Mexico have already been diagnosed with measles. Now, measles is a highly infectious disease. It's typically seen in young kids and almost exclusively associated in individuals that have not been vaccinated. The measles vaccines are extremely safe and extremely effective, widely available, and they not only prevent the rash and the fever, but they prevent it from being transmitted. Of these 58 new cases, 13 have been hospitalized, which is give you an idea of how fast this is spreading. The number, even updated as recently as today, is now over 90 new cases. Most of them are in Gaines County with 45 documented incidents, and this is according to the Texas Department of State Health Services. So again, measles, a disease that we thought that we'd really put into the rearview mirror many years ago, now continues to pop up here and there, particularly in under-vaccinated communities. There's even some messaging that's been going on that adults who have been vaccinated, if they're exposed, they may have weakened immune systems, depending if they've had a kidney or a liver transplant or are getting chemotherapy for cancer, or have another medical condition that requires medication that blunts the resilience of their immune system. So if you fall into that category and you're in or near one of these communities with measles cases, you might want to call your local healthcare professional and ask whether you need a boost if you've had measles vaccine as a kiddo, particularly, according to the literature, individuals who have been vaccinated before 1968, when the vaccines became more effective and more durable. So a word to the wise there. So as I said in the opening remarks of the show, we're going to be talking about farm-related injuries and farm safety today. And I thought I would just remind our audience what some of the statistics are. And of course, for those of you that work on our farms and ranches, you don't need much reminding because you deal with this every day. If you look at the number of death rates per industry, per 100,000 workers, you can see that mining is the number one at 30 per 100,000 per year. Agriculture is number 24. And then even below that is construction, below that is manufacturing, and below that is general industry. So while many may think that construction, for instance, or manufacturing are some of the highest risk trades, that is definitely not the case. Agriculture is 1.5 times, and mining and our natural resources is almost exactly twice the death rates. And the 5 top causes are overturning farm machinery, typically tractors, falls, toxic chemicals that are exposed to, particularly in pesticides and herbicides, suffocation, now of course that most commonly relates to grain bins, and then heat-related injuries. And we've talked a lot on previous broadcasts about heat stress, the signs and symptoms, and the treatment both in the field and when it's appropriate to call for help for heat stress. Some recent data shown 170,000 agricultural workers die each year from injuries. Think about that. In the United States, 60 to 70 out of every 100,000 farm workers die every year. In 2022, the fatal injury rate for agriculture, forestry, fishing, and hunting workers was 18.6 deaths per 100,000 full-time workers. And that transportation incidents we've talked about, tractor injuries, heavy machinery, etc., remain the leading cause of death for farm workers in the United States and have been for many years in the past. Common hazards we've talked about. This is an all too common picture of a tractor turned up. Collisions with other farm vehicles, poisoning from biological and chemical substances, falls and slips, particularly in cold, icy conditions, drowning, burns, animal-acquired infections. You know, we've talked a lot about high-path flu, but there are many others, grain bins and silos, hazardous equipment and machinery, heat, sunlight, and even noise are major risk factors for hazards and farm-related injuries. So what's the summary for this week for rural America? What do you need to know about rural health? What really matters? First, that COVID wastewater levels, cases, and hospitalizations are still presenting at a pretty flat level in rural and urban communities. Overall wastewater levels are flat. Hospital rates and mortality rates are slightly down. Updates regarding high-path avian flu, still deemed very low risk to humans, although we're up to 7 cases now with 3 recent hospitalizations. Spread to wild birds, domesticated poultry, and dairy cattle are associated with human infection, and those numbers continue to slowly rise. We talked a bit about the measles outbreak in Texas and made the point that our vaccines are both safe and effective. And then just as an entree and aperitif, we talked a little bit about farming injuries, making the point that many of them are preventable. Precautions and preparation are key to farm safety. And so, before we go to break, we're going to open our phone lines to you. Please call us, 877-731-6733. And when we come back, Dr. Ellen Duysen.
Hi, I'm Caleb, and this is my story. I was born with osteogenesis imperfecta, or brittle bone disease. I have broken my bones almost 200 times, and I have had 11 surgeries. But I didn't let that stop me. I love to bike ride, climb, race, and I'm learning how to stand and walk. But I can only do all of this because of generous people like you and Shriners Hospitals for Children.
Because of people like you, Shriners Hospitals for Children has helped more than 1.3 million kids just like me, regardless of their family's ability to pay.
Shriners Hospitals for Children is only able to provide this world-class, life-changing medical care because of the generous gifts of people just like you.
Because of you, I can ride my bike. I can play basketball.
Because of people like you, I can run.
I can smile.
Will you send your love to the rescue today?
When you go to loveshriners.org right now and give just 63 cents a day, you're helping kids just like me.
Like me. Like me.
When you give today, we'll send you this adorable Love to the Rescue blanket as a thank you and a reminder of the love you gave to a kid just like me.
Your gift, no matter how small, can help a child today.
This is your moment to make a difference.
When you pick up your phone, I know you have it right there, and call to give. You're helping kids like me. Thank you.
Thank you.
Gracias.
Thank you.
Please call or go online now. If operators are busy, please call again or give right away at loveshriners.org.
Your gift makes a difference. Thank you for giving.
Welcome back to Rural Health Matters. I'm Dr. Jeff Golden. Thanks so much for being with us tonight. We're joined this evening by Ellen Duysen, a fan favorite. Ellen is the Assistant Research Professor at the University of Nebraska Medical Center College of Public Health. But she also serves as the Community Outreach Specialist for an organization named the Central States Center for Agricultural Safety and Health, better known as CS-CASH, because that's a really long name. With degrees in public health, microbiology, equine science, along with first-hand experience in agriculture, Ellen brings a wealth of knowledge to our discussion. Ellen, it's so great to have you back with us on Rural Health Matters. I know our audience really enjoys being with you. And before we start talking about farming and ranching safety, which I know you're so passionate about, you might tell our audience a little bit about your story, about where you grew up and how you got interested in farm safety.
Well, thank you. And Thank you, Dr. Cole, for the very, very nice introduction. I don't think I've ever been called a fan favorite before, so I truly appreciate that.
You definitely are.
Thank you. So, my background in coming into the agricultural world started with horses, and I think that's the way a lot of folks get into this business. And started with riding and a love for horses, and then I made a big leap, and I married a hog farmer. And that's a huge leap for a girl who was born in Phoenix and had never slopped the hogs before. So we raised hogs along the Front Range in Colorado for about 17 years. And once we figured out that we had lost enough money doing that, we moved to Southwest Iowa to be close to family and raise cow-calf operation, which, believe me, a lot easier than those hogs. So once I had an opportunity to join CS Cash as an outreach person, I had been at the Med Center. I've been at the Med Center for 30 years, done a lot of research in pesticides and cancer, actually. So this was an opportunity to work with the folks that I've come to admire and really love very much, these rural communities.
Well, your contributions have been huge, and let's start to talk about some of the experiences that you've had. But particularly, what I'd like to focus on tonight, Ellen, is the change in seasons. You know, it's been unusually cold, certainly here in Nebraska and in other parts of the country. And what's the impact of that on our farming and ranching communities? You know, I talked to some of our farmers and ranchers, and they're just really, really concerned about how long this is going to last, what it means to their cow-calf operations, and even what it may mean to some of the planting season concerns.
Yes, absolutely. And here in the Midwest, we have just gone through some extreme cold last week with a few days that we did not get over zero. And for us in farm safety, our big concern is those workers out there working in the elements. And you know, you noted quite correctly that one of the major causes of injuries and fatalities are slips, trips, and falls. So when we think about that, we always like to remember everyone. I would like everyone listening right now to kind of take a look down or take a look in your entryway and think about the boots that you're wearing out there to work every day. We have, you know, really, there's some great new boots that you can get that actually will accommodate some really good, you know, clamp on metal steel toes. You know, there's a time for cowboy boots and there's a time to not put those cowboy boots on. You know, we need to make sure that the treads are really good on our shoes. Another thing that we really think about and are very concerned about is with the slips, trips, and falls is we don't have a lot of light, especially many of you, and I know we are here in the Midwest, we're starting to calve. And you're going to be going out in the night at night, not a lot of light. And I will tell you, next time you are at your local hardware store or a farm supply store, pick up a headlamp that has high lumens. And many of you may already have that, but making sure that you have something that is going to light your way very well. And another concern, and we've had several here in our region, are barn fires. We've got folks that are really trying to take care of those new calves. It may be, you may have other livestock that are in the barn. I know some people are foaling already as well. And that means that we're using heat lamps and heaters. And when you put those heat lamps with next to combustibles, it can be a real issue and have caused several fires here in our area. And so thinking in terms of those safe lamps or safe heaters that if they are turned over, will turn off, and always make sure there's a cage around that heat lamp. One of our most tragic fires was caused by an unguarded heat lamp. So check those barns, check them for, check those electrical outlets, your wiring. Let's keep those barns intact and all those animals safe through this cold weather.
All very, very good advice. Well, we have our first caller on the line tonight, Ellen. That's Jim from Pennsylvania. Jim, thank you so much for being part of our broadcast this evening. And what's your question or comment?
You're welcome. What type and duration of corticosteroids are used to alleviate the microthrombosis associated with COVID?
Jim, you know, microthrombosis, which is a fancy medical term for clotting in tiny blood vessels, is not uncommon with COVID. And the reason being is that the COVID virus has a way of causing our blood elements to clot more than it would normally clot. And whether it causes clots in small blood vessels, which is known as microthrombosis, that you asked about, Jim, or it can even cause clots in great big vessels, such as in your arm or in your leg or even in your thigh or in your hip, and cause complete blockage of venous blood flow, which causes not only short-term problems, which is pain and swelling and blue coloration of your toes and of your skin, but can also cause long-term problems, which is known as DVT, or deep venous thrombosis, and venous insufficiency. So your question, which relates to the treatment of it, is really very relevant. So it can produce acute symptoms, which is usually treated with blood thinners, typically either heparin or low molecular weight heparins, and then oral therapies, of which there are several different types. Some are warfarin-likes, also known as Coumadin. Others are synthetic antiplatelet drugs. Even low-dose aspirin has been used for many of these as well. And for some, there's an inflammatory component, and that inflammatory component, as you question, Jim, tonight, is usually blocked with either low-dose or moderate-dose steroids, sometimes with prednisone, depending upon how severe it might be. It could be with hydrocortisone or other drugs as well. Your question, though, is how much at what dosage? And that really depends upon the individual patient. Some patients need higher doses than others. Typically, healthcare professionals will start off at a lower dose, and depending upon progression or symptoms, build that dose up until they get the desired effect. So for you, if you had an experience with microthrombosis or deep venous thrombosis, the correct dose would really be determined by your local healthcare professional who knows what medications that you're on and how severe your symptoms are and how much microthrombosis you're actually having. But it was detected very, very early on, back in the spring of 2020, that anticoagulation, at least for hospitalized severe cases, because of the microthrombosis in the heart, in the kidney, in the lung, and in the liver, and in the periphery, even in the brain and in the eyes and in the spinal cord, became a problem that folks were anticoagulating. So, Jim, I hope you're well. I hope you're not suffering from microthrombosis, and I thank you for calling. And that leaves the phone lines open for any of you. Please do call us at 877-731-6733. And let's get back to Ellen now and talk a little bit more about farm safety. You mentioned that you've done a lot of work on toxic chemicals, pesticides, herbicides, and things of that nature as well. And are there any updates that we need to be aware of as we transition from the winter into the spring season on our farms?
Oh, yes. Yeah. And I think this is a great time to be prepared, right? Starting preparing. We prepare our equipment. We're in there making sure that our planters are ready to go. Our tractors are ready to go. So I think now is a great time to also start thinking about safety. And you mentioned all the chemicals that we store, the pesticides that we store, and it is imperative. It is so important that those are not only stored appropriately, which, when you look at every one of those chemicals has a safety data sheet associated, and some of them should not be stored together. So making sure you, first of all, understand the chemicals, but also making sure that those where they are stored are away from our kids. One of the things that is very different about farming, as you all know, is that we raise our families right where we work. You know, when my kids walked out the door, they were right next to these hog barns, so they were playing and enjoying themselves within feet of where we were doing some work. So I think making sure that not only are all our chemicals properly labeled and kept in those same containers, that I know that's something that when we mix things, sometimes we don't do. But if you do mix and move from another container, make sure that it is labeled correctly, because one of the tragic things that can happen on farms is poisonings. And also, please, those of you that are applying pesticides, remember what you learned in your pesticide safety trainings, and make sure that all that gear is clean and ready to go when you will be applying pesticides this season.
Good advice. So we have our next caller on the line. We have John from Washington with us. John, thank you for calling. And what is your question or comment for us?
Dr. Gold, I have a question regarding COVID-19. There have been reports that coronavirus vaccines' spike proteins have persisted in some patients, causing a lower immunity to other diseases, and may have contributed to long COVID or PVS, post-vaccination syndrome, in some individuals. Is there any study that indicates this may be true or a possibility?
Let me answer your question. First of all, John, thank you for that great question. I really appreciate it. And let me answer your question generically and then in some little bit more detail. There has never been a vaccine or a medication that I'm aware of that has ever been developed that doesn't potentially have some type of either short-term or long-term side effects. The whole purpose of drugs, whether they're vaccines that are administered to prevent disease, or whether they're medications that are to cure or to mitigate the severity of disease, have these effects that we understand. And so in every instance, it becomes a question of risk-benefit ratio. And for instance, we recently celebrated the anniversary of the first development of polio vaccines. There is no question that polio is a devastating, life-threatening disease that was radically changed by the development of the new generation and even the original generation of vaccines, to the point that parents previously were afraid to send their kids to school, to athletic events, to even go outside and play because of the fear that they would get polio, end up on an iron lung, hospitalized, and die. So all of these vaccines, including the COVID vaccines, have a well-understood set of reactions. Some are long-term, some are short-term, etc. But there is no question that the long-term effects and the short-term complications, or what called vaccine reactions, are far outweighed by the benefit. Now you're asking a very specific question, and that is whether in a post-COVID vaccine condition, whether there are instance reports of weakening immune tolerance as opposed to strengthening immune tolerance. And that, of course, is going to vary greatly from individual to individual, depending upon how strong or how weak your immune system is, whatever drugs you may be on, etc. I am not personally aware of a definitive study, but I'll commit to you this, John, that I will look it up, talk to some vaccine experts, and if you tune in next week, I will have an answer for you as to what research shows in terms of the frequency, the severity, and the consequences of exactly what you've asked about. So, and I appreciate your call and your very good question, and about generally all medications, all vaccines, and the potential short and long-term effects. That leaves the phone lines open, 877 855-731-6733. We're going to take a really short break, and after that quick break, we'll be back with more Rural Health Matters and more opportunity to talk to Ellen Duysen about farm safety. Thanks for being with us tonight.
Ooh, fun. Yikes. The leaky refrigerator coil card. Is that bad? Oh, death! Death? Of an AC fan motor. Oh, no. But your future is bright with an American Home Shield warranty to protect your covered appliances and home systems. Are there bees behind me?
My bees escaped.
Bill, we talked about this. American Home Shield. Don't worry, bee warranty.
I'm Mike Russell. Next time on Farm Week, hope for citrus country. Imagine if 90% Mississippi's ag production was wiped out because of a row crop disease. Florida's citrus producers have faced this situation, but now researchers are hoping to turn things around. Using technology, they're precision breeding citrus trees that can produce fruit despite exposure to the bacteria. Making lemonade out of lemons next time on Farm Week.
Next on Wood Songs, Cutter and Cash are teenage brothers. They just got 2 standing ovations at the Grand Ole Opry.
I lost all my money, but $2, that $2 bill, boy, $2. Lost all my money, but $2.
And Phoebe White is a 15-year-old American yodeling cowgirl.
Fridays, 6 p.m. Eastern on RFD TV.
Connect with Rural Radio Channel 147 and Sirius XM. Call into our live shows at 855-776-6147 or leave a voice message with us and you could be on the air. We want to hear from you. Scan the QR code on your screen to see our schedule at ruralradio147.com and listen on the go with your premier agribusiness and rural lifestyle channel. Rural Radio Channel 147 on Sirius XM and the Sirius XM app.
Thanks for joining us again with Rural Health Matters. It's a great opportunity to answer your questions and, of course, to talk with our special guest, Ellen Duysen. Our phone lines are open for you. It's great to have you call, and we now have Ed from Florida. So you think about that. We've had the Northeast in Pennsylvania, we've had the state of Washington, and now we're down into southeastern United States in Florida. Ed, please go ahead with your question.
Thank you, Dr. Gold, and go Gators. I'm 82 years old, and I'm sure I had a mumps and measles vaccine when I was a kid, but that would have been back in the 1940s. And from what I'm hearing, it might be a good idea for me to go ahead and get another shot. What would be your recommendation on that?
Yeah, so, the Centers for Disease Control has, first of all, thank you for your question. The Centers for Disease Control, for the longest time, have believed that the measles, mumps, and rubella vaccines, the MMR vaccines that have been around for a very long time, are extremely effective and are essentially lifelong vaccines. There have been some rethinking of that, particularly with the measles outbreaks that we've been reporting on this broadcast, and specifically for individuals such as yourself and myself who were vaccinated before 1968. A lot of it depends upon whether there's any reported measles in your community in Florida, Ed. And what I'd recommend is just giving your primary care healthcare professional a quick call and say, what do you think? The risk of these vaccines is extremely low and they're extremely effective, but if they're not necessary for you and your community, there's no point in even getting poked in the arm with one of these vaccines if it's not necessary. It's all, as I said a few minutes ago, this all comes down to the risk-benefit ratio. If there's no benefit, there's no point in taking any risk. However, if there are concerns of measles in the schools or in young kiddos in your community, as they are in certain parts of Texas now, New Mexico, Oklahoma, etc., that would be a pretty good indication to get something done in the way of a boost of your vaccine, particularly, given your age, or if you're on some medications that could possibly weaken your immune system. Thanks for calling, and that leaves the phone lines open for our next caller. And let's get back to Ellen and talk more about farm safety. We've talked earlier on numerous times we've been together, Ellen, about flooding on farms and the seasonality that goes with that, relating to some of the snow melts that occur even in relatively dry seasons. This has been a pretty dry season across, until just recently here in Nebraska, we've had almost no snowfall at all. So does a dry season predict less in the way of farm flooding, or is that something that our farmers and ranchers need to still be aware of?
Well, thank you for that question. And I think that's something, if we think back to the flooding that we always think back to here in the Midwest, and especially in Nebraska and our surrounding states, it was the 2019 flood. That was caused by a bomb cyclone. So it was, we had frozen, our rivers and our tributaries were frozen, but there was no anticipation that there would be a flood event like that until we had that. We had a large rain, a big warm up, sent those ice flows just crashing through our rivers and creeks and tributaries, causing this massive flooding event. Not only in along the farm ground, but also along the Missouri River as well. So it's always time to be prepared for a flood. And that is really where we talk about emergency preparedness. Having those of us that now have been through this, I think we think more in terms of what would we do? What do we want to have available? Is there a place that we can take our cattle? I was talking to someone the other day. We have to make hard choices. If you have a number of animals that are needing to be moved to high ground, you're going to need to prioritize. We know we're going to get our family and humans out first of all, and probably some of us are pets. But then there needs to be a priority so that you're not making that hard decision when these emergencies happen. And it's not just flooding. It can be a fire event. It can be an event of a tornado. And so having this preparedness, having thought about this, even writing it down, we really urge people to put it as part of their farm risk management plan. How are you going to manage this? It's going to be a financial hit, but it's also a huge emotional hit too. And so how can we make that a little bit easier by preparing?
Well, that probably applies to all kinds of severe weather events, I would imagine, as well. Well, we have Lethra from Oregon on the line. Lethra, thank you so much for joining us this evening on Rural Health Matters, and please go ahead with your question or comment.
Hello. My remarks are more farm-oriented. I think my biggest recommendation would be don't go out on the acreage where nobody knows you're there, because so many accidents could be kept from being fatal if somebody knew you were there. I have one friend who was in the creek checking the intake on his irrigation pumps. Great swimmer. We don't know what happened, but he drowned. And nobody knew where he was. They started looking for him. They knew he was working the irrigation stuff, but they looked for him, and they finally found him in the evening. Another farm not far from us, a gal was out with an auger on the tractor setting fence posts, and they believed that her shirt got caught in the auger. She tried to free it. It sucked one arm in. She tried to get the other arm, tried to get the arm out with her other arm, and they both got sucked in. And she almost bled to death before somebody found her. So letting people know where you are. If you move to a different segment in the farm, call somebody and say, hey, I'm moving up to the northeast corner now. Just let people know where you are working so that they can get to you quicker if you are unable to call for help. Thanks for listening. Bye.
Well, thank you for calling, Lethra, and thanks for that good advice. Ellen, what do you think about Lethra's advice? Are there early warning systems that people could wear around their necks or on their wrists, that if they get into some kind of problem, if they're working alone, that they could notify somebody, similar to what we do with some of our geriatric patients who are living alone?
Yes, absolutely. And Leather, thank you for sharing that. We know that telling stories that are personal, and all of us in agriculture can relate to, someone who we've loved or cared for, or at least been good acquaintances with, who have been injured or had fatality. So thank you for sharing that. And I think that is just the best advice. I love it. So we know that we would advise everyone to have a communication advice on your person. And so that right now looks a lot like a cell phone. I will tell you, at least in our region, we used to have some dead spots. Now that the 911 has really, really improved service. So there may be some spots, and I would say there are likely some spots in the U.S. where you won't get service. So really letting someone know where you are. And Dr. Gold, you ask about wearable devices, right? So, right now, some of us wear smart watches. I was working the other day. I think I was shoveling or something, and my watch started vibrating. It said, "It looks like you took a fall." And if I had not responded, "No, I'm perfectly fine," I think it was not used to me shoveling or something, but it would have alerted 911, which I just think we did have, which is great. And we did have a farmer who fell from a height, and his cell phone alerted 911. He fell from one of his bins, and they were able to then rescue him. So I think there's some great technology out there that we can use and we can implement, and I'm hoping that we'll have less of those incidents that Leathra talked about happening.
Well, thank you for that. As we're getting into calving season now, do you have any special advice for safety for those that are in the cow-calf producing business?
Yes, there again, get those good boots on that are going to get you out in the snow and the ice. If you have to wear those crampons, put those on. Making sure, we get fatigued. We went through that. We had, when we were calving, you're out there checking in the dead of night. In our area, that may have involved, groundhog holes or something. So you need a really good light. We also, we talk about putting lights up, and there's some great solar lights that you can put up on your barns. So if you're bringing those cattle in and you're checking them in pens, you can still have some really good light there that you can see, and to avoid those slips and falls. And then we always talk about the contact with the livestock. So important with those moms, and y'all know that have worked with cattle. This mom that was just in your pocket and being the best girl, coming up and rubbing on you one day, as soon as she has that baby at her side, can be a different kind of animal. She can be like a bull in a ring. She's going to protect. So making sure we don't turn our backs. Every time we walk into a pen, I'm looking for a way out. And we're tired, so this is something that just has to become habit. If I'm going in with any animal, even no matter how much I trust that animal, I need to have an escape route. So just a few simple things that are going to keep us safer.
All really good advice. I can't help but notice as we're having this conversation this evening that there are a number of heads with hats and other gear on the bookcases behind you. And maybe you could take us on a little tour of what that stands for and why it's important to you, or maybe it's just a collection that you want to talk about.
No, these are my folks here. We spend a lot of time hauling them around to outreach events. You know, we talk about protection from head to toe, right? So what you're seeing here is some really wonderful head protection. And I'm going to my left and my right are a little opposite, I'm afraid, but we have one of my favorite pieces of PPE, which is if you own a chainsaw, you need to have this chainsaw helmet because it's 3-in-1. You've got your noggin protected with a hard hat. You've got the built-in earmuffs, which are so essential. And then you've got a screen coming over your face that is going to keep that brush and blowback from getting into your eyes, but still wear those goggles underneath it. So that piece of equipment is not only affordable, but it's something that is going to protect that head and your ears and your eyes. And we've had several folks tell us it shows that they have had branches fall on those helmets and have broken the helmet, but they survived. So that was it's really gratifying to see. And that is my favorite piece of PPE. And then, of course, ATV helmets, essential. We have such a huge number of folks dying and becoming paralyzed from these ATV incidents, and especially our children. If I could remind everyone that those full-size ATVs are not toys, and to please keep your children off of those. There's lots of smaller ATVs that they can use. And then right over my shoulder, I'm going to try over there, right here, over this shoulder is my cowboy. That is actually a hard hat. So when I go out to western Nebraska or I go over to Colorado or some of our cowboy countries, I take that hat to demonstrate that you can still look kind of stylish while you're protecting your head as well. And then we have some respirators, full face respirators behind me as well that I'd love to talk more about sometime when we have more time.
Well, maybe we'll have you back in the future because I know our audience is really excited. So one of the things that we have really not talked about, we have just about a minute left, is H5N1 and some of the research that you're doing. And maybe, in a very simple sentence or two, you can tell us how much concern there is and what we should do about testing.
Yeah, a lot of concern. And my concern, we know we have animals that are being affected. My concern is the humans. And it's not just that virus mixing and becoming, getting another pandemic. But what we need to also realize is there's a lot of emotional concern, whether you are having to depopulate 5 animals or 500,000. If you are in that field, please get some help after you've had to depopulate.
Well, I think that's very good advice. We have reported now for pretty well the last year on every broadcast the number of milking dairy cattle, the poultry populations, etc., that have been affected. And I think your comments are really, really important, particularly now as we're starting to see a little bit more in some other states just besides California and Nevada. I want to thank you for joining us tonight. We will definitely have you back. If we didn't get to your question, please give us a call.